Have you ever looked at your pill organizer in the morning and thought, how did I end up needing all of this just to get through the day? It's not uncommon to feel overwhelmed or even frustrated by how many different medications you're expected to manage. What used to be as simple as an aspirin here and there has slowly turned into a routine filled with bottles, instructions, refill dates, and sometimes side effects that seem to create more problems than the ones they're supposed to solve. The truth is, as we grow older, our bodies go through changes that make managing medication a bit more involved. What once worked perfectly at 40 might affect you differently now. That's not a failure of your body. It's just a natural shift that requires a new kind of attention, one that can make all the difference in how you feel, move, and enjoy your day. Today, we're going to talk about exactly that, how to take control of your medications so they support your health instead of adding confusion or risk. We'll look at how to understand what you're taking, how to stay organized without stress, and how to talk to your doctor in a way that gets you answers, not more uncertainty. Let's start with something that often goes unnoticed, knowing what each medication is actually for. It might sound obvious, but many people take pills out of habit without really remembering why each one is necessary. Maybe your doctor prescribed something years ago, and you just kept refilling it. Or maybe a specialist added something new, and now your routine feels like a patchwork of instructions. Taking the time to reconnect with the reason behind each medication gives you back a sense of clarity. When you know what's helping your heart, what's easing your joints, or what's managing your blood pressure, you're more likely to take it as intended. And you're far more equipped to notice if something doesn't feel quite right. That brings us to something even more important, listening to your body when you start something new. It's easy to assume that a new pill will just fix the problem it's meant to treat, but medications can sometimes bring unexpected effects. You might feel more tired than usual, or your appetite could shift. You might even feel a bit foggy, or experience changes in your digestion that weren't there before. These subtle shifts matter. They're your body's way of telling you how it's responding. And if you notice them, don't push through and hope they'll pass. Bring them up, write them down, and most importantly, trust that you deserve answers, not assumptions. Of course, it's one thing to know your medications, it's another to keep them all in order. If you've ever missed a dose or taken something twice because the day got away from you, you're not alone. Life doesn't always unfold on a perfect schedule, and remembering pills on top of everything else can feel like just one more chore. But setting yourself up for success can be surprisingly simple. Some people find that keeping medications in a visible spot, near the kettle or next to the toothbrush, gently reminds them without feeling like a burden. Others prefer using a pill organizer, one with compartments for morning, noon, and night. The beauty of that little box isn't just that it holds pills. It holds peace of mind. You don't have to guess. You don't have to remember. It's right there, already planned out. But even with the best systems in place, questions still come up. Maybe you wonder what happens if you accidentally skip a pill. Or maybe you're curious about whether two medications could interact in a way your doctor didn't mention. These questions are not silly. They are smart. They are protective. And they are the key to staying not just medicated, but well. Which leads to perhaps the most powerful piece of all, your relationship with your healthcare provider. It's easy to feel rushed in an appointment, like you only have a few minutes to cover a dozen concerns. But your voice matters. Your questions matter. And your understanding of your medication should never be an afterthought. If something is confusing, say so. If you want to know if there's an alternative with fewer side effects, ask. If you feel like one prescription might no longer be necessary, bring it up. You are not being difficult. You are being responsible. And if something doesn't feel right, if a doctor brushes off your concern or fails to explain things clearly, you are allowed to seek another opinion. This is your body, your time, your life, and the people you trust with your care should make you feel seen, not silenced. The way you handle medications can influence your entire quality of life. It's not just about remembering a schedule. It's about feeling like you're the one steering the ship, not just along for the ride. When you take ownership of your medication plan, you move from uncertainty to empowerment. You stop reacting and start making choices. You stop guessing and start understanding. And that understanding leads to something even more valuable than a well-stocked medicine cabinet. It leads to confidence. Confidence in how you manage your health. Confidence in how you communicate. And confidence in how you navigate each day. Knowing you're not just following instructions, you're making informed decisions for a healthier, more vibrant life. One thing many people don't expect as they grow older is how much managing medication becomes part of their daily rhythm. It's not just about taking what's prescribed. It's about being fully present in the process, aware of how medications fit into your overall well-being. There's a difference between swallowing pills out of habit and truly taking charge of what those pills are doing for you. That shift starts when you stop looking at your medications as something you have to deal with and start viewing them as tools that serve you, tools that require your active input, not just your compliance. A powerful step toward this kind of ownership is staying alert to how medications behave over time. Some prescriptions don't affect you the same way they did when you first started them. Your metabolism may have changed. Your diet might be different. You could be more sensitive now to things that used to feel neutral. That's not a flaw. That's your body adjusting, adapting, and asking you to notice. Ignoring those cues can lead to discomfort that builds quietly, but acknowledging them gives you the chance to fine-tune your care. And sometimes it's not your body that's changed. It's your lifestyle. Maybe you're more active now. Maybe you've lost weight or changed your eating patterns. Those shifts can affect how medication works, even if the prescription hasn't changed. That's why ongoing conversations with your healthcare provider are so valuable. You're not just checking in for the sake of it. You're helping them understand the current version of you, not the version from a year ago. Another layer to think about is how medications can affect your emotions. Not many people talk about this, but it's real. Some prescriptions can bring on feelings of sadness or irritability. Others might leave you feeling dull or less engaged. And because these effects don't always show up in obvious ways, they often get overlooked. But when your mood doesn't feel like your own, it's worth considering whether your medication might be playing a part. You're not imagining things, and you're not overreacting by bringing it up. In fact, that kind of awareness is one of the strongest indicators that you're fully tuned into your health. Now, let's talk about something a little less clinical, but just as important: memory. Keeping track of multiple medications can be a challenge, especially when timing matters. If you've ever found yourself second-guessing whether you took a pill or if you took the right one, you're not alone. But rather than relying on your memory alone, consider how you can outsmart forgetfulness with small routines. That could mean syncing your medication schedule with other habits, like having your pills with a certain meal or during a specific show you never miss. It's not about being rigid. It's about anchoring your routine to things that already feel natural. Technology can be another helpful partner. Some people find comfort in using reminder apps or smart pill bottles that light up or beep when it's time for a dose. You don't have to be tech-savvy to benefit from these tools. You just have to be open to a little help. Think of them as silent supporters, guiding you behind the scenes so your brain can focus on more meaningful things. But what happens when you start to feel like your medication isn't doing much at all? That sense of doubt can sneak in slowly. Maybe the pain relief doesn't seem as strong, or your blood pressure stays a little higher than it used to. That's when people often start making quiet changes, having a dose, skipping a day, or adding an over-the-counter supplement without checking first. It's easy to understand why. You're trying to find a better balance. But adjusting your medication without support can create ripple effects you didn't anticipate. A change in one pill might affect another. Something that feels like a small tweak can shift your whole system. You deserve better than guesswork. You deserve a clear, confident plan that feels right for your body, not a routine built on trial and error. And let's not forget that sometimes medications aren't the only factor at play. What you eat, how well you sleep, even how much water you drink, all of it can shape how medication works. If a pill upsets your stomach, it may be because it's interacting with a certain food. If one makes you dizzy, dehydration could be amplifying the effect. That's why paying attention to your daily habits is so essential. You don't need to become obsessive, but staying curious about how your body responds gives you a kind of insight no doctor can provide. All of this is part of a larger truth. Medication management isn't just about following directions. It's about understanding the relationship between your lifestyle and the medications that support it. You are the constant in the equation. Everything else, the prescriptions, the labels, the guidelines, they all orbit around you. Which means you have the power to shape the experience into something that works for your life, not against it. There's a quiet strength in taking control of your health in this way. It's not loud or dramatic. It's steady. It's thoughtful. It's in the questions you ask, the notes you take, the moments when you pause to consider, Is this still right for me? That kind of reflection isn't just useful, it's powerful. It turns routine into care. It turns medication into self-advocacy. And when that shift happens, when you move from being a passive recipient of prescriptions to an active partner in your health, everything begins to change. You start to feel more prepared, more confident, and more capable of living your life with clarity instead of confusion. There's something reassuring about having a routine, especially when it comes to your health. But routines, if left unexamined, can become habits we no longer question. Over time, it's possible to get so used to a medication schedule that you forget to consider whether it's still meeting your current needs. That's where reflection becomes more than just helpful. It becomes essential. It's the pause that lets you look at everything you're taking and ask, is this still helping me in the way it's meant to? One aspect that can quietly shift over time is how multiple medications work together. Not necessarily in the sense of side effects, but more in terms of overlap. It's not uncommon for 2 or 3 prescriptions to address similar issues, especially if they've been added by different doctors over the years. You may have started one for sleep, another for mood, and a third for nerve pain, but together they could be creating more fogginess than clarity. This doesn't mean they're wrong for you, but it does mean it's worth revisiting the bigger picture with someone who understands your whole health history, not just one condition at a time. Something else that's worth considering is how often we settle for tolerating symptoms we don't think are serious enough to mention. Maybe you've been feeling slightly more tired in the afternoons. Maybe you've noticed your balance is off just a little. These details might seem unrelated to your medications, but more often than not, they're part of the story. Sometimes a small adjustment to your dosage or the time you take a certain pill can restore the energy or steadiness you didn't even realize you'd lost. Your well-being doesn't have to be dramatically off track to deserve attention. For those living with multiple health conditions, the juggling act can be particularly intense. You might be managing blood sugar, arthritis, blood pressure, and cholesterol all at once. That's a lot to balance, and each medication comes with its own rhythm. Some need to be taken with food, some without. Others depend on your activity level or the time of day. Rather than letting all those rules become a burden, it helps to think of them as pieces of a puzzle. When the pieces fit, your body functions more smoothly. And if something feels off, that's your signal to look for a better fit. One approach that's often overlooked is having a medication review with your pharmacist. Doctors prescribe, but pharmacists see the full picture in a way that's often more holistic. They notice if your prescriptions have been filled too frequently or not frequently enough. They can explain why a generic might feel different than the brand name version. And most importantly, they're trained to recognize interactions or duplications that can slip through the cracks. Sitting down with someone who understands medications from every angle, but isn't rushed like a busy clinic might be, can bring a new layer of understanding to your routine. There's also something to be said for the emotional side of taking medication. It can feel like a daily reminder of limitations, or even stir up guilt or frustration. Maybe you've wondered why your body needs so much support now, or felt embarrassed to carry pills when you travel. Those feelings are more common than people admit. But what if instead of seeing your medications as reminders of what's wrong, you saw them as proof of how committed you are to staying well? They aren't a weakness. They're a form of self-care. They're part of a plan you've chosen to help yourself stay active, present, and engaged with life. And it's perfectly okay to make peace with needing support. There's no gold star for getting through your 60s, 70s, or 80s without help. The real measure of strength is in the willingness to listen to your body and respond with care. That might mean continuing a prescription that works. It might mean letting go of one that no longer serves you. But either way, you're making informed, thoughtful choices, and that matters. Something else to keep in mind is how stress or emotional strain can influence how medications work. If you've been experiencing more tension or worry, your body might process medicine differently. The same goes for grief, loneliness, or even lack of sleep. You might find that something that used to work beautifully now feels less effective. It doesn't always mean the dosage is wrong. Sometimes the context has changed. Addressing the emotional landscape you're living in can be just as important as managing what's in your pill box. And while we're on the subject of changes, it's important to remember that not every adjustment needs to come from a prescription pad. Sometimes a shift in your daily habits, a new breathing exercise, a short walk at the same time every day, even a change in what you eat for breakfast, can complement your medications in ways that amplify their effect. These lifestyle layers don't replace medicine. but they can strengthen the foundation it's working on. Your body, like any system, responds best when its different parts are supported together, not separately. Through all of this, communication remains your strongest ally, not just with doctors and pharmacists, but with yourself. Noticing how you feel, acknowledging what's working, asking questions when something feels off, and believing that you have every right to feel good, to understand your care, and to expect clear guidance. Managing medications isn't just a task to check off, it's a conversation with your health that continues every single day. One of the most overlooked parts of managing medications isn't the pills or the prescriptions themselves, but the environment in which they're taken. The surroundings you're in each day, the lighting, the noise levels, the way your space is set up, can quietly influence how well you stay on track. If you take your medications in a hurry, while distracted or multitasking, it becomes easier to miss a dose or forget whether you've already taken one. But creating a quiet, consistent space for that moment each day turns it into something steady. It stops feeling like a chore and becomes part of your personal rhythm, a habit that's less likely to get lost in the shuffle of everything else. In many homes, especially when there are visitors or shared spaces, it can feel uncomfortable to leave pill bottles out in the open. But when medications are hidden away in cabinets or drawers, it's easier to fall behind on your routine. Discretion is important, but not at the cost of forgetfulness. One solution that helps is keeping medications in a dedicated, attractive container that fits into your home like any other meaningful object. It becomes a visual reminder without screaming for attention, something that says, "This is a part of my wellness, not something I need to tuck away." Another dimension that isn't always talked about is how medications are managed during travel or life transitions. Whether you're heading out of town for a few days or staying with family, the change in routine can be enough to throw your system off. If you've ever reached into your bag and realized you left one key prescription behind, you know how unsettling that can feel. That's why it helps to prepare a simple travel version of your medication plan, not just a pill case, but a small note to yourself about what to take when, written in your own words. That tiny effort ahead of time can prevent stress later and help you feel grounded, even far from home. For those who rely on others for support, such as caregivers or adult children, there can be another layer of complexity. Maybe someone helps you refill your prescriptions or reminds you when it's time to take them. In those cases, clarity is your best ally. A shared calendar, a printed list, or even a quick text reminder can make a world of difference. It keeps everyone in the loop, reduces misunderstandings, and ensures that the focus stays on your well-being, not on correcting mistakes after the fact. And it's perfectly okay to ask for that kind of support. Accepting help with grace is part of advocating for yourself. Sometimes what makes managing medications challenging isn't a lack of tools or reminders. It's the emotional weight of taking them every day. It might feel like a badge of aging, a daily marker that your body needs help. But if you reframe that thinking, the story changes. Every pill you take with intention is a quiet affirmation of life. It's not a sign of decline, but a signal of choice, your choice to continue showing up for yourself, to keep investing in your body's strength, and to do what's needed to feel your best. What often makes the biggest difference is how much control you feel in the process. That sense of agency, of knowing you have the final say in what goes into your body, can transform the way you relate to your medication. You're not just following instructions. You're actively participating in your health. You're setting boundaries, asking the right questions, noticing patterns, and speaking up when something doesn't feel right. That kind of engagement is powerful. It's a declaration that your life, your health, and your peace of mind are worth protecting. And the beauty of it is that no matter where you are in your health journey, it's never too late to bring more clarity to how you manage your medications. Whether you're newly navigating a prescription for the first time or have been balancing several for years, every small improvement you make adds to your confidence. You're not just aiming to remember pills. You're aiming to feel steady, alert, and in tune with your body. This is also about making room for joy in your days. When your health feels unpredictable, it's harder to enjoy the little things. A phone call with a friend, a walk through the garden, a quiet afternoon reading your favorite book. But when you've taken time to understand your medications and create a system that works for you, your energy opens up. You're no longer focused on managing uncertainty. Instead, you're making space for presence, connection, and comfort. So as we bring this conversation to a close, I want to remind you of something simple and true. Your health is worth every bit of attention you give it. Your questions are worth asking. Your needs are worth honoring. You are not defined by the number of medications you take. You are defined by your commitment to living a life that still has laughter, still has strength, and still has purpose. Medication, when managed thoughtfully, is just one part of that picture. If anything in this video spoke to you, I'd love for you to share your own experiences in the comments. Your story could help someone else feel less alone. And if you found this helpful, don't forget to like and subscribe. There's always more to explore, and we're building this space together, one conversation at a time. Here's to taking your health into your hands with wisdom, care, and a whole lot of heart. You've got this, and your best years are still very much ahead.